Hello everyone. Today I'm going to cover the various drugs to increase the gamma chain synthesis and about the splenectomy and dietary management of thalassemia patients. So what are the drugs for the increasing the gamma chain synthesis? So these are the drugs for hemoglobin F gene stimulation. It reduces the precipitation of unpaired hemoglobin chain also. So in this 5-azacitidine, hydroxyurea butyrate, erythropoietin and thalidomide we can use to increase the hemoglobin F concentration. The use of these drugs mainly for the thalassemia intermediate, but we can also use for thalassemia major. And recently combination of erythropoietin and hydroxyurea in thalassemia major, which increase the expression of hemoglobin F gene, improve the hemoglobin, so reduce the need of transfusion. Instead of 2 to 4 weeks interval transfusion, patient may not require the transfusion even up to 3 or 4 months. So the frequency of blood transfusion decreases, iron overload decreases, so the further complications of the iron overload and the iron chelator side effect all decreases. Now about the splenectomy. Indication for the splenectomy in thalassemia major patients are: first indication is when transfusion requirement increase to 1.5 times of normal, or if we are calculating yearly transfusion, so more than 250 ml per kg per year of PEG cell RBC, or more than 400 ml per kg per year of whole blood. If we are not having facility for the PCV and we are giving whole blood, then more than 400 ml. Or if the patient is having hypersplenism and complication of this, or very huge splenomegaly which causes the discomfort to the baby. So these are the indication for the splenectomy. Before splenectomy, immunoprophylaxis should be done. So child should be vaccinated for pneumococcal, H. influenzae and meningococcal vaccines 4 weeks prior to the splenectomy. Splenectomy should be delayed till the age of 5 years, as there is a greater risk of sepsis in less than 5 years age group. If we are doing the splenectomy due to the hypersplenism, or patient is having more requirement of the blood, as I said in the previous slide, more than 250 ml per kg per year, then we can perform even in less than 5 years. But in less than 5 years age group, we have to give the chemoprophylaxis also with the oral penicillin. So 125 milligram BD for children less than 2 years age group, 250 milligram BD for children between 2 to 5 years age group. If child is allergic to the penicillin, then alternative antibiotic to the penicillin, example amoxicillin, trimethoprim, sulfamethoxazole, erythromycin can also be given. Post-operative thrombocytosis is common in the thalassemia patients. After doing the splenectomy, we have to repeat the CBC. If platelet reaches 10 to 20 lakh per mm cube, in such a case we should start the aspirin 80 mg per kilogram per day to prevent the pulmonary microemboli due to the platelet aggregation due to thrombocytosis, which is a common complication after splenectomy. Now, what is the role of wheatgrass tablet or juice in the thalassemic patients? In literature, it is mentioned that wheatgrass is the best source of obtaining the plenty of chlorophyll, and chlorophyll is structurally similar to the heme. So it get absorbed rapidly, and once it is absorbed, the cells in the bone marrow get almost ready-made molecule of heme, which after a few changes converted to the heme. Thus, heme production occur at a faster rate than otherwise, and patients have the significant increase in mean hemoglobin level and decrease in the frequency of blood transfusion and requirement after wheatgrass therapy in the thalassemia patients. In dietary and supportive therapy, we should advise the diet to decrease the iron intake. So we should tell the patient to avoid the iron rich food, example dates, jaggery, green leafy vegetable, beet, in fruits, pomegranate, all these diets should be avoided. And we should also advise them to drink tea or coffee at the end of lunch and dinner. So with the meal, they should consume the tea or coffee so the iron absorption will be decreased. We should tell them to consume the phytic acid rich food, example cereals. Diet which contain the adequate calcium, milk and milk products should be consumed in sufficient amount, at least 500 ml in a day. Phosphorus rich food should be consumed, moong dal, soya, cereals, peas. Folic acid supplementation should be given 1 milligram daily. Vitamin C supplementation should be given to the patient, those who are on the iron chelators. Vitamin E and D3 supplement should also be given, and zinc supplement should also be given to the thalassemic patient. So this is all about the splenectomy and dietary management and the drugs to increase the hemoglobin F. Thank you so much.